Some concerns over COVID-19 protocols when people line up for their vaccine. At St Augustine's Hospital in Durban, healthcare workers have to stand in long queues. They've been doing that this morning as well. eNCA senior reporter Desan Thatia is outside the hospital for us. Let's find out from him what's happening at the moment. Desan, a very good morning once again. And since we last spoke, has there been any more clarity on what is the hold-up at St Augustine's this morning, especially with the sort of preparations that need to be made ahead of phase 2 for Monday?
Sorry, Rebecca, you caught me just greeting someone now off camera. That was Prof. Abdul Karim. He was just walking past here, so he's just stopped by to say hello. But back to the matter at hand, Rebecca, you'll see that as we've moved up here closer to the hospital entrance, this is where the lines are now converging. You'll recall earlier we were about maybe 500 meters down this road. This is the entrance, and then off to the other side, there's another line that has developed here. Although we don't have an official response from the hospital yet, I have sent out that inquiry. It does seem at this point that it's because of mixed messages that have been circulating. Now, hospital staff have been trying to make sure that that everyone is aware of what's going on, those that are here. But they have been using a loud hailer as well as sending people into the line to talk to them. But I also have just found out that DENOSA has been engaging with the management here at the St Augustine's Hospital. And I have with me now Mantla Shabangu, who is from DENOSA in the province. Mr. Shabangu, I believe you just walked out of a meeting with the hospital management. What's causing these delays that we're seeing here?
Good morning, Desan and viewers at home. The situation inside is not looking good. I spoke to both managers. Remember, this is St Augustine, it's a private sector party. The vaccination was for both public employees, the healthcare workers, and private. So there are two groups inside. There's a group of healthcare workers from the Department of Health, and there's a group of private sector, meaning private, those are GP, whoever who is not, who's private. Now, I'm told that there were messages that were sent from national to people where they register, Sisonke, to say even if you don't have appointment or voucher, just come in. Now, that is why you are finding now a group of people all converging in one, because as from 2 weeks back, the process has been smooth here in the site because people who are coming are those with appointment and vouchers. But this message that came from Sisonke has caused the whole instability inside, because now you find two groups of people here, but the understanding is that people who must be here are people with SMSs and appointments. So we've spoken to management to say how to then navigate that part, because we expect that every healthcare worker who's here must be vaccinated no matter what. Yes, tomorrow is a deadline for this vaccination program, but we are saying they should move it until sometime next week so that all workers are vaccinated, because we don't want a situation where we're expected to go and vaccinate the over 60 that have started being registered without all healthcare workers all being vaccinated. That is why we are concerned.
What about the reports that on the other days that some of the vaccines had run out? Now, that has also caused frustration with some of those that we've spoken to, because they're saying that they had queued here just like this the whole day, only to get that message inside. It sounds to me like there's a problem with communication.
There's a serious problem with communication, because Sisonke should communicate through managers who are here on site, in our understanding, so that the people who are here are passing the correct message to the department employees and to private sector. Now, if there's going to be a communication also in the meekly that is not in line with what is happening on the ground, that's why we're having a problem. The site managers here, when they come on duty, they already know how many people are having appointments, and they prepare accordingly. Remember, the vaccination, there's a strict protocol on safety issues regarding it. So they cannot willy-nilly come with extra vaccine. They should come with a record that says tomorrow, according to appointments, we're expecting so much. Now, this message has just been sent randomly to people is causing a problem that when you come and you are not in their preparation, you will find a situation that the vaccine is not there.
And just quickly as we wrap up, Mr. Shabangu, there's obviously also a bigger problem here, and that's that there's absolutely no social distancing in this queue. People are gathered in groups here, and this is the case all the way down the road to the next side road as well. Is this process being managed at all?
This process is not managed at all, but I'm glad that one of the acting DDGs of the department has just arrived representing the department, because we don't want a situation where this event is going to now cause more spread of the virus, because there's no social distancing. I've been inside, I struggled to even come out of the gate because people are just want to push inside. There is no social distancing outside, but inside all is in order because the social distancing has been prepared long time. It has been flowing, but our main problem is here outside. We are saying there's a police van that has just come here now, so we expect them, maybe they will try to manage these queues in a manner that social distancing is maintained.
But whatever the case, it seems like not everyone that's standing here is going to get that vaccine today.
That is true.
Thank you very much. That's Mantla Shabangu Uveka. This seems like this is a situation that is going to have to be managed very carefully, because there are people that are already frustrated in this queue. Some are that are returning, others that have been queuing here from very early this morning. But as you've just heard now, it seems like some of them at least will be turned away because of these mixed messages that have now been circulated.
A very dangerous and worrying situation there, and if that communication problem that he described is as bad as it is, it's certainly something we don't need at this stage ahead of getting our senior citizens there. They can't go through with these people who are relatively younger. Most of them are actually going through at the moment. Thanks very much, Ades Ntatia, outside St Augustine's Hospital. Not looking good at this stage for phase 2 if you just look at what is happening there at this late stage.